Hello, my dear students of the course Biopharmaceutics and Pharmacokinetics 2. This is part 2 of the topic metabolism. If you remember, we were talking about clearance, okay, and we looked at the relationship between clearance and the CPSS. CPSS is equal to the dosing rate divided by clearance. We also came to know about the CPSS-3, which talks about the concentration of free drug, that is unbound drug in the plasma, because the free drug is the one that is responsible for giving the pharmacological effect. Why I'm talking here about the free drug, later you will come to realize that it has an influence on drug-drug interaction. Okay. طيب, now we will be talking about venous equilibration model equation. Venous equilibration model equation. Now what we are talking about here, we are going to think of a liver as an isolated organ. تخيلوها كأنه it's just an organ. Okay, so blood supply goes to this organ where elimination happens. So the equation that describes this is referred to as venous equilibration model equation. So we will think again as the liver as an isolated organ. So we will not think about kidneys, something else. We will think about an isolated organ such as liver. And to this liver, the drug reaches the organ through the blood supply. Now you have to think, okay, if we say this is the organ, okay, this is the liver, blood comes in with a flow rate, for example, let's say 1450 ml per minute, and this is Q, we will call it Q, and the concentration in the artery, just imagine it is concentration in the artery, Ca, and the concentration decreases when it goes to the veins, we will call it Cv, okay? So we have concentration in the artery coming in and a decreasing concentration that comes out in the veins. And طبعا here what is happening here is that the organ is removing some of the drug. So this liver or this organ is removing some of the drug, and this can be measured by what we call extraction ratio. Extraction ratio, يعني how much this organ can remove as a fraction, or you can think of it also as a percentage. This extraction ratio is actually equal to the concentration in the artery minus the concentration in the vein divided by the concentration in the artery. This is the extraction ratio. طبعا if you look carefully in this equation, it will be from 0 to 1 maximum. 1 means 100%. Okay, يعني when the concentration in the vein is 0, okay, because all of the drug has been extracted by the liver, so it will be Ca by Ca, يعني concentration في artery divided by the concentration in the artery. It will be 1, which means 100% extraction. Okay, if I want to calculate the clearance, it will be the hepatic clearance. So I'm writing here CLH, or I can write it as CLM. Okay, I can also write it as CLM. CLM. The clearance by metabolism will be equal to the extraction ratio multiplied into Q. يعني Q multiplied by extraction ratio. I can write it also as Q multiplied into extraction ratio. Okay? This is not the Venus equilibration model equation, but I'm trying to explain to you how isolated organ clearance can be thought of. Okay? So this is what we were talking about. Organ clearance is equal to Q, the blood flow, multiplied by extraction ratio اللي هو concentration في الارتري minus concentration في الvein divided by concentration في الارتري. Of course, when E is high يعني closer to 1, closer to 100%. Okay, and sometimes they say when it is more than 0.7 يعني more than 70%. Okay, this means that there is extensive metabolism for the drug. طبعا if it is less than 0.3 معناته we have ايش low extraction ratio وبالتالي low metabolism. Now they found, okay, in the liver, when we are talking about liver, that this clearance is related to three factors. One is Q, and Q can change in physiological, is a physiological factor. It can change in certain diseases, like for example, congestive heart failure, and is an liver clearance can be influenced by blood flow and by something اللي هو fraction unbound. The fraction unbound يعني how much of the drug is free, because you know that the free drug is the one that is susceptible to metabolism, and also what we call intrinsic clearance. Intrinsic clearance I later will talk about it. طيب, what is Q? As I said, it's the blood flow. Fu is the unbound drug. Okay, طبعا you know the drug usually will bind to, depending whether it's weak acidic or weak basic, it can bind to albumin or globulins. And we have, as I said, the intrinsic clearance or the free intrinsic clearance. They call it free because you need to think of it as what? As if there is nothing that affects the metabolism. يعني the blood flow will affect metabolism. The fraction unbound will affect the metabolism. Suppose we don't have these factors. In this case we call it free intrinsic clearance. يعني in the absence of any limiting factors, we call it free intrinsic clearance. And here it talks about what? About one, how much enzymes are there in the liver. This is the most important thing. Okay, في الهيباتوسيلز, في السيلز بتاعت الليفر, how much enzymes are there, معناته how much capacity it has. Okay, how fast the drug goes to the tissue, اللي هو hepatocytes, how fast, how easy it gets inside the tissues, and how easy it gets out as well. For example, through biliary secretion or by going back to the blood. This is what we refer to intrinsic clearance. In another way to represent this idea is I want you to think about cars or buses waiting for you in the university to take you to your homes. Okay, now the clearance, your clearance, يعني to remove you from the university to outside, depends on what? Depends on how fast you go to the cars, يعني how fast you go down to the cars, how many cars are there, and how many seats are there in the cars and buses. صح ولا لا؟ This is what you think about. This is what I want you to think about when I say intrinsic clearance. Isn't it's like what is the capacity of the liver to metabolize in the absence of any other factor such as the unbound fraction and the blood flow. ليش بحكي هيك? Why I say these factors affect clearance? Because for the unbound drug, it will be the one that can be subjected to metabolism. If the fraction unbound 0, for example, I'm just giving an example, hypothetical example. If it is 0, then nothing will go to get metabolized. صح ولا لا? The same thing is with the blood flow. If there is no blood flowing to the liver, then nothing will be metabolized. فإذا when I talk about free intrinsic clearance, I mean in the absence of other factors. Okay, so liver clearance was found to be influenced by these three factors, and through these three factors we have the venous equilibration model equation. طبعا the clearance, hepatic clearance, can be written as Q اللي هو ايش الكيو اللي هو blood flow multiplied into a ratio. هذا you can think of it as the extraction ratio. إذا extraction ratio can be calculated by اللي هو fraction unbound. زي ما حكينا الفراكشن unbound يعني from 0 to 1 multiplied بالintrinsic clearance. طبعا الintrinsic clearance will have the unit of clearance اللي هو ml per minute for example. This is divided by blood flow اللي هو برضه بالml per minute plus اللي هو fraction unbound في الintrinsic clearance as the المقام يعني هون. Okay, so this makes the extraction ratio. So this is what we call the venous equilibration model. It can be applied to any isolated organ. يعني why we are saying isolated organ? Because we don't want to think of any other factors influencing the clearance of this organ. طيب, assuming that the drug is cleared only through metabolism. إذا هلا بدنا نحكي إنه the drug clearance, total clearance, بكتب here CL total is equal to the clearance by liver or let's say metabolism. Okay, اللي هي نفسها الهيباتيك clearance CLH. We will assume that. فشو بصير عندنا؟ CPSS that is equal to the dosing rate divided by ايش؟ بده يكون عندنا الكليرنس by hepatic clearance. Why hepatic clearance? Because it is the same as the total clearance. طيب, we can divide drugs and their clearance اللي هو by hepatic clearance. We can divide them to three classes. شو هم هدول الثري classes? We can divide them as flow limited drugs, capacity limited drugs, and others. But what I'm talking about here, I'm talking about drug clearance by by metabolism. طيب, when do we classify the drug as flow limited? Its clearance is flow limited. شو يعني flow limited؟ يعني controlled by Q. Okay? طيب, when do we classify the drug as capacity limited? Capacity limited يعني FU لو fraction unbound في intrinsic clearance. And when do we classify it as others? Others means all factors سواء ال Q, ال F, the fraction unbound, or the intrinsic clearance, the free intrinsic clearance, all these three factors will affect the drug clearance. إذن drugs can be classified either two flow limited يعني its clearance بدي اكتب هون its clearance is influenced by the blood flow or its clearance influenced by fraction unbound في intrinsic clearance or all of them. طيب we classify the drug as flow limited in case متى بتكون flow limited؟ if the fraction unbound في الانترنسك clearance اللي هو الانترنسك clearance again قديش في enzymes قديش how much the liver is able to metabolize. Okay, if this is very high compared to blood flow, لاحظوا انه هون اليونتس تاعتها بالام ال per minute البلد فلو وبرضه هون بالام ال per minute. Okay, so both we have ml per minute. When the drug is has high extraction ratio يعني الليفر باخده the liver will take a lot of the drug that comes in, okay, and it will metabolize this drug. When there is a high capacity for the liver, in this case what controls the clearance is the blood flow. بصير اللي بيتحكم في الكليرنس البلد flow. Why؟ تخيلوا التالي. Imagine the following situation. There are a lot of buses and a lot of cars waiting for you to take you home. طيب مين اللي بيتحكم في الكليرنس here? It's not the buses and the cars because there are a lot of them. What controls the clearance or your removal as students from the university to your homes is how much you are getting there, how fast you are getting to your cars. اللي هو blood flow. So the more there are of you, طبعا how will be there more of you if there are many students who are going and reaching these buses, these cars, then there will be a lot of removal. You don't have any problem with cars and buses. Here you don't have any problem with the enzymes. You have a lot of enzymes. They are able to take care of the drug. Then the problem is the drug reaching these enzymes. Then the Q will be controlling the process. عشان هيك we call it flow limited drugs. Okay? It will be controlled by hepatic blood flow. شوفوا, see here, this is the hepatic clearance equal as we already discussed. It's equal to blood flow في FU في intrinsic clearance. شوفوا هنا شو مكتوب divided by FU في intrinsic clearance. Here, what is missing here, if you remember, if we look here, okay, back here, what is missing is Q plus. وين راحت ال Q plus? Okay, because FU multiplied بالintrinsic clearance is much higher than Q. شوفوا, this is much higher than Q. In this case, I can delete this one without really significantly affecting the ratio. إذا كأنه مثلا لو أحكي مثلا for example, I'll give you an example. 1000. Okay, نعتبر ال 1000, just this is hypothetical. 1000 divided by 1 اللي هو ال Q, I will consider the Q is 1, plus again ال FU في ال intrinsic clearance is 1000. Now look at the ratio. Here the ratio will be about 1. يعني 1000 على 1001, almost 1. So if you remove this one, it will not affect a lot the result. صح? 1000 by 1000 or 1000 by 1001. Not a lot of difference. Therefore, they deleted Q, and so you can divide fraction unbound by intrinsic clearance by the same and multiply it into Q, and you will get Q. إذن what controls the clearance اللي هو إيش؟ Q. That's why they call it إيش؟ flow limited. Examples of such drugs اللي هو عندنا we have lidocaine, propranolol and morphine as examples. Is that clear? طيب بالcapacity limited طبعا you need to memorize these drugs. بالcapacity limited it's the opposite. What controls the clearance is اللي هو fraction unbound في intrinsic clearance. Okay? So in this case, the fraction unbound في intrinsic clearance is much less than the blood flow. Okay? طيب شوفوا شو صار هون. الopposite. Q بالFU في intrinsic clearance is the same as the original equation. Okay? اللي هي Q في الFU في intrinsic clearance divided. هلا instead of removing Q, we are going to remove ايش؟ We will be removing FU في intrinsic clearance here. هلا someone will tell me why not removing this one? No. If you remove this one, it will have an effect. يعني it will change the values. But if you remove this one, it will not change the value, the resulting value of the extraction ratio. Okay? That's why في capacity limited, it will be Q اللي هو blood flow multiplied في extraction ratio. In the extraction ratio we have removed اللي هو FU في intrinsic clearance because in this case it's much less than Q. So removing it will not affect a lot the resulting clearance value. طيب Q goes with Q شو بصير عندنا؟ بصير عندنا الفراكشن unbound في intrinsic clearance. معناته hepatic clearance is affected by اللي هو fraction unbound في intrinsic clearance. يعني أي تغير في البايندينج أي تغير في intrinsic clearance will affect drug clearance. طيب these two important categories, I want you to know the following. When I say here that drugs such as propranolol or morphine, if there is a change in hepatic blood flow, what will happen? This will change ايش؟ drug clearance. طيب متى ممكن يصير change في الهيباتيك blood flow? This can happen when the patient is taking certain drugs that affect blood flow from the heart, or for example in case of congestive heart failure that reduces for example blood flow to the liver. Okay? طيب what about the capacity limited? When will I have problems here? In certain disease like liver disease it might affect ايش؟ the enzymes في الليفر the fraction unbound as well. في عندنا liver disease that affects fraction unbound as well. Okay? But you have to be careful here because in some cases the fraction unbound is affected but not the intrinsic clearance. Or maybe the intrinsic clearance is affected but not the fraction unbound. So you need to be careful. Sometimes the intrinsic clearance is not affected but the fraction unbound increases. And that will cause the clearance to increase. So you have to take both into consideration. Examples على the drugs that belong to capacity limited drugs اللي هي الفينايتوين, okay, anticonvulsant warfarin, anticoagulant quinidine, which is given for heart condition, okay, اللي هو arithmetic heart, anti-arithmetic. Now these drugs they belong to capacity limited اللي هم their extraction ratio is small. يعني شو السمول هو اللي بيسوي effect. شوفوا هنا مين السمول؟ السمول is Q. So Q is affecting the clearance. هنا مين السمول؟ اللي هو fraction unbound في intrinsic clearance. So it's doing the it's affecting the overall clearance. طيب look at the example here. tolbutamide اللي هو for hypoglycemic agent. وجدوا in patient with hepatitis اللي عندهم hepatitis معناته there is ايش inflammation of the liver في عندنا problem في الليفر. وجدوا انه there is no change في الانترنسيك clearance يعني كأنه الانزيمز are intact. الانزيمز that are dealing with tolbutamide are okay. There is nothing wrong with them. But they found that the fraction unbound increased. إذا when fraction unbound هيو if you increase in fraction unbound يعني الفري دراج صار زيادة. There is more free drug. طيب هاي الحالة شو بصير بالكليرنس للتولبياتومايد للي عندهم هيباتايتس for those who have hepatitis. Some people believe that okay, because hepatitis أكيد for sure the metabolism will decrease. No, in this case actually clearance شو صار في الكليرنس؟ الكليرنس increased. But why it increased? It's increased because the free drug has increased. Okay? So you have to take both factors into consideration. Other drugs اللي هم in between, they are not highly extracted, فبالتالي they are not flow limited, ولا low extraction ratio عندهم, وبالتالي they are not capacity limited drugs. So all the factors are important, وexamples عليها الثيوفيلين والانتي بايرين. Is that clear? طيب, when we talk about systemic, مش systematic. Systematic is a different thing. Systemic availability. You are taking, for example, the drug orally. Let's suppose that all of the drug get absorbed. انتبهوا للمصطلح. Pay attention to the term. All of the drug get absorbed. That doesn't mean that all of the drug will reach the systemic circulation. Why? Because there is a pre-systemic, or what we call first pass elimination. Now, for some drugs, this can be very high. Here we'll call it the extraction by the liver. For some drugs, this extraction can be very high. يعني if you give, for example, 100 milligram, only maybe 20 milligram will reach the systemic circulation, or 10 milligram. That's why you will see that the doses that is given, or the doses that are given orally compared to, let's say, IV, is having a big difference. They are having a big difference. For example, morphine, اللي حكينا, we already said that it is a high extracted drug. هي morphine. بنلاقي, for example, the oral dose is 30 milligram compared to 5 milligram by IV. Then there is a big difference. Why I am talking about this case, or the drugs with high extraction ratio? The reason is, if there is a problem with the liver, such as hepatitis, or maybe a worm infection, or some kind of problem, there can be what we call porta-systemic shunts. يعني the drug, مع انه في عندنا hepatitis that can affect the enzymes, the drug, instead of going through the liver, it's bypassing the liver and going directly into the systemic circulation. If I'm talking about drugs with very high extraction ratios, زي المورفين والبروpranolol, these drugs in such cases شو بصير لها if you take it orally? It will be absorbed, it will not go through the liver, but it will bypass the liver, or go around the liver and into the systemic circulation directly. To the extent that the oral dose will act as an IV dose, كأنه أعطيته IV. Okay? For example, هيو 30 milligram of morphine orally may act as 30 milligram given by IV. ليش? Why? It's because of the disease, or the condition of the liver that prevented the drug from getting metabolized. Okay? I hope this is clear for you. I'm going now to give you little deep or little clinical case for you to think about, and we'll solve it inshallah together. Okay, we have phenytoin. Okay, والphenytoin بيصير له metabolism by cytochrome B450. العائلة طبعا here you will see the specific enzymes اللي هو 2C9 و 2C10. Okay, these are the specific enzymes. هذا الphenytoin was administered to a patient by intermittent IV administration and produced steady state plasma concentration of 15 milligram per liter. طبعا here I'm talking about the total concentration. total شو مقصود فيها التوتال؟ انه الفري والباوند. That's what it means. The therapeutic range is 10 to 20, which is good. يعني good to have 15 because it's in between 10 and 20. يعني inside the therapeutic range. طيب, the patient unexpectedly experienced acute renal failure. صار عنده renal failure وانتم عارفين معناته الجي اف ار راح يكون GFR will be less than 15 ml per minute. طيب, renal failure is known to reduce plasma protein binding of phenytoin from 90% to 80%. إذا البايندينج بقل تاع الفينايتوين 90 بتصير ايش؟ 80. معناته الفري فينايتوين كان 10%, now it is 20%. طيب, but has a minimal effect on phenytoin intrinsic clearance. يعني ما بيأثر على الكاباسيتي of the enzymes. What impact should renal failure have on this patient pharmacologic response? هنا حكى لي pharmacologic response. When it says pharmacological response, I have to think about ايش؟ CPSS الفري, the free drug. Okay. طيب, let's talk about phenytoin. Phenytoin is a capacity limited drug. If you go back, you will see phenytoin as capacity limited. معناته its clearance is affected by fraction unbound and intrinsic clearance. طيب, intrinsic clearance did not change, but the fraction unbound changed. Okay, so let's think about it now. Let's talk about how to answer this example. طبعا the clearance, the hepatic clearance of this drug is equal to fraction unbound في الintrinsic clearance. شو صار بالفراكشن unbound؟ الفراكشن unbound doubled. شوفوا, this is bound, كان 10% الفراكشن unbound. Because of renal failure صار 20%. معناته الفراكشن unbound doubled. طيب, السي بي اس اس التوتال شو يساوي؟ it's equal to K0 اللي هو rate خلينا نحكي dosing rate divided by fraction unbound في الintrinsic clearance. Okay, this is the clearance. ليش حطينا هنا هاي؟ because this is equal to ايش؟ to the total clearance. Okay. طيب, بما انه this doubled, هذا صار له doubling, شو بصير في الكليرنس؟ it will double, and when this doubles شو بصير بالسي بي اس اس؟ بصير الهاف, بصير تقريبا 50%. اوكي, 50% من الاصلي. طيب, because it's 50%, what do you expect? You expect that, oh, there is a problem. يعني it was 15, now it will be about 7.5, which means that the therapeutic range is not met. صح? And this is wrong. If you answer like that, it's wrong. What is giving the effect is actually the free drug. والفري drug هو عبارة عن ايش؟ الفراكشن unbound multiplied into CPSS التوتال. هذا هو CPSS التوتال. طيب CPSS التوتال, what happened to the CPSS total? Became half. صح؟ CPSS التوتال is 50% of the original. But the fraction unbound is doubled. فكأنكم تحكوا 2 multiplied into half CPSS. شو بصير؟ بصير 1 CPSS. It means that the free drug will ايش remain the same. يعني even though the total CPSS became half, okay, even then the effect or the pharmacological effect or response will remain the same. Okay, and why? This is because the fraction unbound increased while the CPSS decreased. Okay, and this is what we say. You should anticipate no significant change in this patient's pharmacological response, despite a significant drop in phenytoin steady state total concentration. ليش? Because steady state free drug concentration remain unchanged. However, the total concentration necessary to achieve this therapeutic unbound concentration will be less than the normal reference. يعني مع انه even though it will be about, let's say, 7.5, يعني less than therapeutic range, بضل steady state free drug same. Okay, شوفوا, this is 10 to 20, this is the therapeutic range, this is the original CPSS total. Now when you have renal failure and the unbound drug increases, what will happen? شوفوا, CSS total صار ايش له? Decreased from here to here, but the free drug remained the same, it did not change. Okay, معناته everything will be okay for this patient. This is how you should think about this clinical problem. I hope this is clear for you and that you have enjoyed this topic. If you have any question, as usual, please do not hesitate to ask me, and you know the different ways to contact me. Have a nice day.